As of this week, the CDC is advising all of us to prepare for the possibility of the spread of the coronavirus.
Now, shortly after President Trump spoke yesterday afternoon, the government announced a worrisome development. A person in the U.S. infected. It was someone in California who was not knowingly exposed.
And News 5's Renee Skinner has more on this newest case and then what the CDC says they expect in the future.
That's right, Bree, Ira, this latest development is huge because the newest case out in California would be the first where the individual didn't travel or have any contact with an infected person. Now, it's also a sign that efforts to contain the virus's spread haven't been enough. More than 81,000 cases of the coronavirus, an illness characterized by fever and coughing, and in serious cases, shortness of breath, even pneumonia, have occurred since the new virus emerged in China. The newest case from California brings the total number infected in the U.S. to 60, most of them evacuated from outbreak zones. A key question is whether the president and his administration is spending enough money to get the country prepared, especially as the CDC has struggled to expand the number of states that can actually test people for the virus. Other key concerns are stockpiling masks and other protective equipment for health workers and developing a vaccine or treatment. At a White House news conference yesterday, President Trump insisted the U.S. is very, very ready for whatever this outbreak brings. But standing next to him, health officials who President Trump praised for fighting the new coronavirus, they were stressing that schools, businesses, and individuals just need to get ready.
Not a time to play politics. We want to make sure we have all the funding needed.
We are working closely with state, local, and private sector partners to prepare for mitigating the virus's potential spread in the United States, as we expect to see more cases here.
Now, health officials have spent $105 million in emergency funding and have been looking elsewhere for money. President Trump told reporters he was open to spending whatever's appropriate. The coronavirus has killed more than 2,700 people, most in China, none in the U.S. But scientists still don't understand who's most at risk or what the death rate is. Infectious disease doctors with the CDC say a vaccine for this thing won't be developed at least for another year. Now, I want to address something that's been trending online and on social media. The CDC recently put out this handy guide showing how various forms of facial hair can affect how protective gear, such as facial masks, actually work. Well, this guide was not created in relation to the current coronavirus and can be used when trying to protect yourself from any infectious disease. Handlebar mustaches and soul patches are apparently okay according to this guide, but full beards, mutton chops, and stubble, well, they aren't great. The CDC says they can affect the function of a respirator mask. Ira, back to you.